Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Treatment of Wilms tumor. So, in the Wilms tumor, the main treatment consists of surgical excision is the treatment of choice. In the surgical excision, the main treatment is by transperitoneal. We can do a transperitoneal radical nephrectomy is done, and this transperitoneal radical nephrectomy is the treatment of choice. Then, routine exploration of contralateral kidney is not necessary. We do not need to do or explore the contralateral kidney if nothing suggests the bilateral process. If there is nothing in the imaging or during clinical examination or imaging or anywhere it doesn't suggest that there is bilateral kidney process going on, then we do not explore or open the opposite kidney. Then, in unfavorable histology, but if the patient has unfavorable histology, then you should start radiation therapy. Radiation therapy is started within 10 days after nephrectomy. Radiation therapy is started within 10 days after nephrectomy, whereas the chemotherapy should be started within 5 days after surgery. So, this is different. So, radiotherapy should be started within 10 days after nephrectomy, whereas chemotherapy should be started within 5 days after nephrectomy. Immediately, you should start these. Then, in the chemotherapy, we should give the vincristine, cyclophosphamide, doxorubicin, and dactinomycin are given for the chemotherapeutic regimen. This is only done in unfavorable histology. Then, if the patient has pulmonary metastasis, then whole lung radiation is done for pulmonary metastasis. For pulmonary metastasis, whole lung irradiation is done.
thank you and thank you for watching.